Have you ever wondered if all those routine health checkups and screenings are really keeping you safe as you get older? What if I told you that some of the most common medical tests for seniors could actually do more harm than good after a certain age? I know it sounds surprising, but the truth is, not every health exam is as harmless as it seems, especially for people over 70. In fact, some tests can lead to unnecessary stress, risky treatments, and even serious complications that could have been avoided. Today, more and more doctors are realizing that when it comes to senior health, one-size-fits-all testing doesn't always make sense. In this video, I'll reveal 5 health screenings that seniors might want to think twice about. I'll explain why even experienced doctors sometimes skip these tests for themselves. If you care about your health but want to avoid being overtreated or overwhelmed by the healthcare system, this video is for you. Let's empower ourselves with knowledge and make smarter choices for a healthier, happier life after 70. Let's start with the first test, the colonoscopy trap. For years, colonoscopies have been called the gold standard for preventing colon cancer. But after age 70, especially if you have no symptoms or family history, this test can quietly become more dangerous than helpful. The preparation alone, drinking strong laxatives and fasting can cause dehydration and dangerous electrolyte imbalances in older adults. The sedation used during the procedure can lead to confusion, dizziness, and a higher risk of falls. And here is something most people realize. Many small polyps found during colonoscopies in seniors would never have caused problems in their lifetime. Yet, finding them often leads to more tests, biopsies, and even surgeries that carry their own risks. I remember a friend, George, who was 82 and in great shape. He agreed to a routine colonoscopy, but the prep left him weak and confused. He fell at home that night and broke his hip months of recovery, all for a test that found nothing. The lesson? If you're over 70 and symptom-free, it's perfectly reasonable to say no to a colonoscopy. Non-invasive stool tests are often safer and just as effective for most seniors. Next, let's talk about the full body scan mistake. The idea of scanning your whole body to catch hidden problems sounds smart, right? But for seniors, these scans like full body CTS or Mr. Is often do more harm than good. They can find harmless incidental findings that trigger a chain reaction of anxiety, more tests, and sometimes unnecessary surgeries. I met Betty, a 78-year-old who felt perfectly healthy until a free scan at a health fair found a tiny kidney spot. She ended up having surgery, months of recovery, and never felt the same again, all for something that probably never would have mattered. Plus, these scans are rarely covered by insurance and can be expensive. The truth is, as we age, our bodies naturally develop harmless changes that don't need treatment. Not every shadow on a scan is a threat. Sometimes, the best thing you can do is trust your body and focus on how you feel, not just what a machine says. The third test to reconsider is the routine cardiac stress test. For decades, treadmill stress tests have been used to check heart health, especially in older adults. But after 70, these tests often give false positives showing problems that aren't really there because the aging heart naturally changes. This can lead to a cascade of more invasive tests, like angiograms, or even unnecessary stent placements, which carry real risks for seniors, bleeding, kidney damage, and long recoveries. I'll never forget George, a retired bus driver, who had no heart symptoms but was sent for a stress test just to be safe. One thing led to another, and he ended up with a stent and a serious infection that took months to recover from. The latest advice from heart experts: if you don't have symptoms like chest pain or shortness of breath, you probably don't need a stress test. Instead, focus on daily walks, a healthy diet, and managing stress. Those are the real keys to heart health after 70. Let's revisit the colonoscopy issue for a moment, because it's so common. Many people don't realize that the risks of colonoscopies like bleeding, perforation, and drug reactions go up sharply with age, while the benefits go down, especially if you've had clear tests before. The preparation can be exhausting, and the sedation can cause lasting confusion or memory problems. I remember Eileen, a retired teacher, who had 2 clear colonoscopies in her 60s and 70s. Her doctor recommended one more at 78, just to be safe. During the procedure, her colon was accidentally perforated. She spent a month in the hospital and never fully regained her independence. The takeaway: if you have no symptoms and a good screening history, it's okay to skip another colonoscopy. Pay attention to real warning signs like blood in your stool or unexplained weight loss, but feel pressured into tests that may do more harm than good. Finally, let's talk about the overuse of heart stress tests. There's something about heart disease that makes us all anxious, and it's easy to think that more testing means more protection. But for seniors without symptoms, these tests often lead to a cycle of more procedures, more medications, and more hospital visits, all with little benefit. I've seen people like Harold, a 76-year-old grandfather, go from a simple stress test to a stent, then 2 complications, and months of recovery, all for a problem that might never have affected his life. The best approach? Focus on quality of life, not just quantity. If you feel well, stay active, and eat right, you're already doing the most important things for your heart. Remember, being cautious doesn't mean ignoring your health. It means respecting it. If you found this video helpful, please give it a thumbs up, share it with your friends and family, and leave a comment below telling us which test surprised you the most or what you learned today. Your feedback inspires us to keep creating high-quality content for you. And don't forget to subscribe and turn on notifications so you never miss our latest tips on senior health, nutrition, and living your best life after 70. Remember, you deserve healthcare that respects your age, your body, and your goals. Sometimes, the bravest thing you can do is ask questions, trust your instincts, and choose what's right for you. Thank you for watching, and I'll see you in the next video.